Hi Lee, my name's Justin.
Hi Justin.
I'll be your fitness instructor today. Thanks for coming in today. You've come in for an appraisal, and basically what we're going to do today is we're just going to introduce you to the gym. We're going to do a very simple questionnaire on your health and exercise history just so we can find out a little bit of information about you. And we're going to do a very, very simple fitness test today. We're not going to be working too hard. It's just a very gentle fitness test, and that's just going to give us an idea of your current fitness levels. So if you'd like to follow me, we'll get started. Okay Lee, so the first thing we're going to do today is a simple questionnaire. And this questionnaire is really designed to find out a little bit about your history. In particular, I'm interested in your exercise history and your health history. So any history of injuries or illnesses I'm really interested in, because that may affect what you can and can't do in the gym today. So if you would answer all the questions as honestly as possible, that would be appreciated. So let's get started. Okay Lee, we've completed the questionnaire now, and I've noticed there's one risk factor that we've been highlighted on the questionnaire, and that is family history of heart disease. So I'm just wanting to probe that a little bit further. Could you tell me a little bit about that? What is the family history of heart disease?
Sure. Well, my mother's under medication for hypertension, and my grandmother on her side died because of hypertension at the age of 45.
Okay. Just excuse me, I'll just take some notes here and write what you've said down. So your mother's on medication for hypertension and your grandma passed away at the age of 45 with a heart-related condition. Okay, so what that highlights, Lee, is that highlights one risk factor for coronary heart disease. Now, on its own, that doesn't put you in a really high risk category. So that doesn't preclude you from doing any exercise today, because to be in a really high risk category, you need multiple risk factors for coronary heart disease, but it does slightly increase your risk. So it's great that you started exercising in the gym, because exercise will actually reduce the risk of you suffering from coronary heart disease, because it is a genetic condition. So what I'd like you to do now is just sign the questionnaire to say that all of your responses are true and correct, and then we can get started. Okay Lee, thanks for completing the questionnaire. The first test we're going to do today, while you're still in a relaxed state, is measure your resting heart rate. Now, the reason I want to measure the resting heart rate is because resting heart rate is just a good overall indication of your current exercise and activity levels. Usually people with a higher fitness level have a lower resting heart rate. The other reason that I'd like to measure your resting heart rate is in the future we can compare your heart rate to what it is today. And as your aerobic fitness increases, we tend to find that the resting heart rate will be coming down a little bit. So what I'm going to do is I'm just going to feel for your heart rate on your left wrist. I'm going to time it for 30 seconds, and then I'll multiply it by 2 just to get the 1 minute heart rate. Okay, and we're starting now. Okay Lee, so we're still in a resting state, still nice and relaxed, so there's one more test that we'd like to do with you while we're still in this relaxed state, and that is measuring your blood pressure. Now, the reason for measuring your blood pressure mainly is because it tells us a little bit about your current health status. High blood pressure is one of the risk factors for coronary heart disease, and especially because you have the family history of high blood pressure, it's quite important that we test your blood pressure just to see exactly where you're at. So what I'll be doing here is I'll be pumping some pressure into this cuff, and you will feel a tightness on your arm there, and it might be a little bit uncomfortable for a few seconds, but I will release the pressure and it won't be uncomfortable for too long. So we'll just get started with that. Okay Lee, thanks for enduring those tests for me. Your blood pressure is really healthy. It's 110/70, which is actually within the normal range, so very healthy. Your resting heart rate is 60, so again that is an indication that you're actually quite fit and healthy. So I'll record these results on your form for comparison later on, and we're ready to get started with the rest of the tests. Okay Lee, now we're going to move on to our tests of body composition. Now the first test of body composition that I'm going to do is using a tape measure. I'm going to measure girths, and the tape measure is used to measure basically the exact shape and size of your body right now, today. The best way to use these measurements in the future, we can actually take these measurements again and make a comparison to see if the shape and size of your body is actually changing. We'll probably find that in some places your body might get smaller, in other places your body might get bigger. So what I'm going to do is I'm just going to reach around and measure your waist girth. In males, we do this at basically your belly button level. So could you put your finger in your belly button for me so I can see exactly where that is? Perfect. Okay, so you can take your finger away now, and I'll just go straight over that point. And your waist measurement is 90 centimetres exactly. Now we're going to progress on to our next measurement of body composition, and today we're going to use a skin fold caliper to measure your actual estimated percentage of body fat. That tells us how much of your body is made up of body fat, basically. Now what I'm going to do today is I'm going to take 4 skin fold caliper measurements, and the reason that I'm using the skin fold caliper measurements today, the most important reason for doing it, is in the future as a comparison point. So if we can accurately measure your percentage of body fat today, then in about a month's time we can measure it again, and hopefully we're bringing down that percentage of body fat over time. So the first skin fold that I'm going to do is on the bicep here. To locate the bicep skin fold accurately, I will find 2 bony landmarks and I will measure the midpoint between those 2 bony landmarks. I'll then make sure that I'm exactly at the midpoint between those 2 bony landmarks, and I'll use the skin fold caliper to come around on the most anterior part of the arm, hold the skin with my fingers, apply the skin fold caliper for 3 seconds, allowing the needle to steady for 3 seconds, and then taking the reading.